Hello, RDs and RDs to be. Welcome to the RD Exam Ready podcast. I'm Zach Caseberg, your tutor, your coach, and guide along the path to passing the RD exam. My biggest passion is to help RDs and RDs to be just like you to know how to effectively pass the CDR exam. And if that sounds like you, then hey, you are in the right place. For those of you who are listening live, you've likely been attending our RD Exam Ready live sessions hosted on YouTube about every other week on Wednesdays. We haven't held a session for a few weeks, and I wanted to say we're probably going to have to wait just a little bit until our next session. I have some major work obligations that are interfering with my ability to host those on Wednesdays. I've got a family to take care of and lots of other things going on. So it's just going to have to take a little back burner for a little bit. I really want to take extra time with those sessions to be prepared, to provide good content for all of you. And if I can't do that, then I don't think the session is ultimately worth it. So until I can really put together some good quality time on those sessions, we're going to take a pause on those. Remember, though, if you do want to stay informed about upcoming sessions, upcoming content, lives, anything like that, join the mailing list that's located in the description of the podcast just so you can know about any type of future events or anything coming up for content or announcements. Now, in general, there's three specific areas of dietetics practice to me. There is clinical, food service, and then thirdly is community. Community is ever expanding in the world of dietetics because there's so many people, especially in the US, who are requiring use of community nutrition programs and community planning. There's plenty of dietitians out there who are implementing and creating new programs to help address the nutrition needs of their community. And when it comes to the RD exam, we know it's quite possible that you're going to see some information on community nutrition questions. You're going to have to be able to decipher the specific programs and program planning that is used for the community and community needs. There's several steps in the process of conducting a community needs assessment, and there's even more steps for implementing a community nutrition program. What you need to keep in mind is that the exam is not asking you to identify every specific step of each process. For instance, exam questions are largely going to give you a prompt of some kind, and it's going to say something like this. Based on the prompt, what would be your next step? Or it may ask about your first step, or perhaps your last. This should give you some peace of mind, RD to be, because in no way is the exam going to say, what is step three of conducting a community needs assessment? That's not going to happen. What's going to happen is you may be directed to say what's going to be the next step, first step, last step. And this is great news because then you can use some of that conductive reasoning that you have to really know what's going to be the best answer. So today, let's go through conducting community needs assessments, community nutrition programs, and apply those to some situational practice questions as well. Let's first start out with our community needs assessment. Now, the purpose of this is so that you can get more information about your community and find a target population for your program. Picture this, you don't know what those in the community need regarding nutrition care, so the purpose of this assessment is to look into that. The needs assessment is also there to gather information related to social, political, economic, environmental, or personal factors that influence the nutrition status of a community. The step by step process for a community needs assessment follows as such. First step is to set parameters of your nutrition needs assessment. Secondly, you're going to develop a data collection plan. After that, you're actually going to collect that data that you planned. Followed by fourth, you're going to analyze the data that you collected. Fifth step would be to share those findings of your assessment. And then the sixth step would be to set priorities. And then finally, your last step would be to choose an action plan. Let's outline each of these steps and let's talk about them a little bit more. Make sure you understand them nice and well. Step one was to set parameters of the assessment, and during this phase, you are specifying the scope of the new community to be addressed, and you're going to determine the purpose of the community needs assessment. You're going to look at its sets goals, its objectives for the needs assessment as well. And remember, when you're determining things like this, a goal is going to be a very broad statement that says what the program is planning to do. And then an objective is something that's very specific, very measurable that you're looking at here. You may be identifying the community or the target population who's at the most critical nutrition needs and set priorities among them. And you would explore things that really impact their health and nutrition status, both positively and negatively within a community, such as food security, grocery stores, or co ops that are around. You'd even look at things like different resources and programs that already exist within the community to help you to tailor new programs or existing programs for a specific population. Now, like I said, I mentioned goals and objectives, and I'll just repeat it again. A goal is a broad statement of direction of the program, and the outcome is something specific and measurable that is being pursued. Now that you understand the first step to a needs assessment, let's talk about step two: develop a data collection plan. Now, the data you're trying to collect is going to depend on the scope of your goals and objectives. For instance, if you're looking at something like food security in the community, your questions and data that you're collecting is going to be related to food security in your community. Remember that you could use both qualitative and quantitative data to properly assess your population. Excuse me. Quantitative data being things like numerical data, age of death, cause of death, labs, weight, BMI, height, hospital records. These are all quantitative data type things. Whereas your qualitative data is going to be things like opinions and insights that may be derived from interviews, key informants, or focus groups who are very knowledgeable about the community and its history. Now that you have a data collection plan, you can move on to step three, which is to actually collect that data. And you could use methods such as a survey to acquire this data. You could use a health risk appraisal, which is a survey or instrument used to characterize the general health of a population. You could do screening activities like that's commonly done in the corporate environment. Excuse me. To really look at the general health and use screening activities like that to say, hey, I'm going to test the blood pressure of all of these different corporate community members to see who's at the highest amount of risk. So these are all different ways in which you could collect data. You could always acquire data through direct nutrition status, things like nutrition focused physical exams, food frequency questionnaires, 24-hour recalls. It's all ways you could go about acquiring that data. But now that you've collected it, it's now time to analyze it. The data is being used to diagnose the community by interpreting the nutrition status of it, interpreting the pattern of services and programs designed to address the target population's nutrition status, and interpret the relationship between the population and those community characteristics. Now we're getting close to wrapping up our community needs assessment. It's time to share and set priorities. And this involves deciding who gets what at what expense. Once you've done that in the assessment, you've learned that there could be several nutrition priorities that may need action, but you need to prioritize which ones you want to focus on because you're not going to be able to develop a program that takes care of all of these health outcomes at once. You're going to have to specify which ones you feel need to be prioritized. There's no one method to prioritize this information. There could be scoring systems used, you could be using your opinion, but really you're looking to see, or maybe you look at what programs already exist in the community. Excuse me. Now, once we've really looked at those set priorities and you've determined what you really want to focus on, finally now we're able to choose a plan of action. The dietitian is now ready to make a decision. They now can hand off the results of the needs assessment in a ranking order of nutrition priorities that deserve the most attention based on the key findings of the assessment. And that would need to be shared with the community leaders and other people who are interested in the health and well being of this target population. These people may use this information within their own organizations to support interventions and programs that are already in place. They may use it to develop new programs in that case. Or the dietitian and other team members may elect to organize a workshop or a conference, and they might decide how to alter an existing program or develop a new program to address these nutrition needs. Now let's go on to actual program planning and let's review our steps here. Before developing your program or modifying one, the dietitian must first create a mission statement. A mission statement being a broad statement or declaration of an organization's purpose or reason for being. Here's our step by step process here. Step one would be to review the results of your community needs assessment. Step two is to define goals and objectives. Step three would be to develop a program plan, followed by step four, developing a management system. Step five is to identify funding sources for the program, followed by implementing the program itself. And then finally, once we've implemented that program, you now need to evaluate the program for its effectiveness. Let's go through each step of the community needs a little bit more, this community program, so you know kind of what you need to know about each one of these steps. Once that community needs assessment has been reviewed, you're looking at it and you're saying, hey, here's the needs of the target population, or here's the nutrition problem. Now, that assessment may tell you what you need to modify a current program or if you need to create a new program. But ultimately, the needs assessment is identifying gaps and services in new programs that may need to be developed to help fill that gap. Once that's been reviewed, you now need to develop goals and objectives. We've talked about goals and objectives a lot already. Goals being broad statements of desired action or outcomes, while objectives being specific measurable actions that need to be completed within a specific time frame. The objectives would really look at components of action or the activity on the target population and indicate of how success is going to be measured. For instance, if you've heard of like SMART goals or SMART objectives, you may know them as being specific, measurable, attainable. Oh, God, SMART objectives. See off the top of my head, specific, measurable, attainable. Uh, R is going to be the last one, and then timely. I'm going to have to look that up as we kind of go through this a little bit here. But yes, you're going to be focusing on SMART objectives. SMART objectives are going to be good because they actually give you a kind of time based analysis of these different objectives. If you didn't have actual objectives that were locked in, it would be very difficult to do that. So, just to run through those SMART objectives one more time, those SMART objectives need to be specific, measurable, achievable, relevant, and timely. That's going to be your SMART objectives in that case. Now, these objectives, as you're looking at, like I said, you need to make them measurable, such as increasing the knowledge of folate rich foods, an improvement of dietary cholesterol, or changes of food security status. An example might be by the year 2030, participants will increase their calcium intake so that 75% of participants consume the recommended calcium intake. So, those could be different kinds of things that you look at there. You can have different things like process objectives, which are measurable activities carried out by the dietitian or other team members when implementing the program, and they would kind of specify the manner in which the outcome objectives will be achieved. So that's kind of a different type of objectives that can be looked into there. A third step of program planning would be to develop a program plan. Using the goals and objectives as a guide, the dietitian develops the program plan, which consists of a description of the proposed intervention, the nutrition education component, a marketing plan, and other factors that may be included. Maybe the max number of clients that are expected, the staff needed, the equipment, the materials, where it's going to happen. This would all fall into that program plan. On to step four is to develop your management system. And when we say management system, we're talking about how we manage the personnel and the data that is being used in the program. The personnel would be the employees responsible for overseeing the program, determining whether all the objectives are met. And the data system that we're talking about here is the actual data that you're collecting throughout the intervention or after. And it doesn't have to be anything crazy fancy. This could be something as easy as an Excel file that you're using to record responses from participants of the program. You just need to have some way of recording and interpreting the data. Now, on to step five, we need to identify funding sources. The dietitian reviews elements and consider whether outside funding in the form of cash grants or contributions from partners is needed or necessary. If so, this would involve the steps of filling out a grant application. Maybe it would be something like talking with community members, asking for donations. It's basically just saying, how are you going to pay for this program, dietitian? And that's a pretty key point. Now, step six is time to implement that program. This is where we actually start doing the work a lot more and implementation. So, you're looking at the set of activities directed towards putting the program into effect. The program is now finalized, our education materials are created, our marketing plan is developed, our staff is trained, and now it's time to actually implement the program itself and link the program goals to plans of action. Once that program has been implemented, now, of course, we're back to evaluation as always, right? So, evaluation and evaluating the program effectiveness is the measurable determination of the value or degree of success of the program, as far as it goes for achieving its objectives. The evaluation will help the dietitian to gather information and to make decisions about redistributing resources, changing the program delivery, continuing the program, or just ending it all together there. There are a few different types of evaluations which we're not going to talk about today. I think I should reserve its own episode for it. But for now, let's look at a couple questions together to finish our day. Number one, a dietitian is conducting a community needs assessment. They've just collected data from the assessment. The next step would be to A, set program priorities, B, share findings of the assessment, C, analyze the data, or D, develop a data collection plan. A dietitian is conducting a community needs assessment. They've just collected data from the assessment. The next step would be to let's use process of elimination to see what our best answer is. For A, set program priorities. Well, when I think logically about the step by step process, if I've just collected the data, would I set program priorities next? Maybe, maybe not. I'll hold on to A really quick. B, share findings of the assessment. I don't think we want to do that because we've collected the data, but I don't think we know much about the data though. So I would actually say let's get rid of answer B. I don't want to share findings yet of the assessment because I haven't interpreted much. C, analyze the data. This seems like a great answer because once I've collected it, I really haven't analyzed it yet, and that does need to be conducted. So I would say C is a great answer for us. I'm going to put a check mark by that. And D, develop a data collection plan. Well, if we've already collected the data, do we need a data collection plan at this point? Probably not. I'm going to get rid of answer D in this case. So if I'm stuck, a dietitian is conducting a community needs assessment. They've just collected data from the assessment. Their next step would be to answer C, analyze the data that they've just collected, would be our best answer in this case. Number two, a dietitian is conducting a program focused on food security needs in elderly adults. What should be the first step of program planning? A, define program goals and objectives. B, review the results of the community nutrition needs assessment. C, develop a management system. Or D, implement the program. A dietitian is conducting a program focused on food security needs in elderly adults. What should be the first step of program planning? Well, A, define program goals and objectives. I do know this happens quite early on in the step. I'm going to hold on to that one for right now. B, review the results of the community needs assessment. Well, hey, I think this is actually a really good answer because I know the first step, and this is asking about the first step, would be looking at really reviewing that community needs assessment and knowing those results. I'm going to put a check mark by B for right now. C, develop a management system. It doesn't seem like that's something you would do first. It might be done kind of midway through the process or towards the end. I'm going to rule out answer C. And D, implement the program. Well, we don't need to implement it yet, especially not as a first step. So I would get rid of answer D in this case. So if I'm stuck between answers A and B, A being define program goals and objectives, and B, review the results of the community needs assessment, my first step would have to be answer B. So a dietitian is conducting a program focused on food security in elderly adults. What should be the first step of program planning? That would be to look at that results of the community needs assessment, or answer B. That wraps up today's lesson, students. I hope you watched, listened, learned, and enjoyed today's show. Remember that passing this exam is a journey and we all need assistance along the way. Do me a favor, hit the subscribe button if you haven't, tell other studying students, rate, review, comment, help spread the word. And as always, happy studying to you, RD to be.